Hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. This week, we're going to be talking about National Community Health Center Week that happens to be this week. National Community Health Center Week happens every year around the second week of August, and it is designed to raise awareness about the mission and accomplishments of the health centers across the country. Joining us today is Ken Lalime, the CEO of the Community Health Center Association of Connecticut. Ken has over 35 years of experience in the healthcare arena. And he will be talking with us today about health centers and their importance in the communities. Now, I'm going to let him tell you a little bit about himself.
Thank you, Keith. It's a pleasure to be here today. And as we talk about different things, often people will say, gee, how did you create this? How did you get here? Career path-wise, what brought you? And I actually think that it wasn't so much as that I was on the career path. I think the path itself went out and grabbed me. Because some of my background, I'm a pharmacist by education, own my own drugstore in the real world, worked at a hospital for 17 years, built physician practices, ran an insurance company, and I felt that kind of what I was missing in all of that was this big push for primary care. And so I started looking around, and all of a sudden this job popped up on the job board that said, come and help us run our companies that are all about primary care. And that's what community health centers do. They do it really well. Primary care is their sole function. They're not doing surgery. They're not doing, specialty care is limited in many of them, but primary care is their claim to fame. So as my career path has moved through all those channels, I've picked up the fact that primary care really does drive the bus. And so if we're all going to get on that bus and to better health, I think that primary care is the way to go. When that job opened up and I looked at it, I was like, I got to get this. And so I just wanted to be part of this movement that is really growing around the country. It's now community health centers treat 30 million patients. So that's a huge number, and it's a pretty cool thing.
So now that we know a little bit about you, let's jump right in and talk about what the mission is of the Community Health Center and why that is important.
So I alluded a little bit to that, but it actually is in writing somewhere. It's not, I didn't just make it up, So it is all about preventive care and primary care. And then the real differentiator is that it's primary care and no obligation to pay. So you have to, basically everybody is welcome at the front door to come in. And the differentiator really is all about culture and community. So that the words, as you look at it, community health centers. So community is just baked into the atmosphere. I mean, it goes all the way through the board of directors. Has to be at least 51% has to be users of the health center in the community. So the mission actually is taking care of a very broad base of individuals, many of color that is missed in many parts of the country. So that diversity that is brought to the table is just wonderful, and the direction that it takes for primary care is just perfect.
What types of services are provided at Community Health Center?
Well, classically I mentioned, I keep going down to the thing, primary care, preventive care, but they provide medical care, pediatric care, OB care, behavioral health, dental. Think about all those things that I just said. If you think about the one-stop shop, you can go in. It's medical care, behavioral health care, and that is the combination of those two has been unbelievably important over the last 18 months. Think of what's happened over the last 18 months, and everybody in the room knows somebody, if it's not themselves, that has needed some level of behavioral health services. It is so critical to the country right now that, look at what's happening in the Olympics. We've got people who are at the top of their game, I mean the top of the top, saying, I can't do this. I'm putting my life in jeopardy by doing this. And they've been doing this their whole lives. So I look at that, and it's at least that's gonna raise awareness, and that's gonna be critical. So they have the medical care that's provided there. The dental services are fabulous in all these places to be able to get that. Behavioral health, some of them have pharmacies. So the cadre of opportunities when you go to a community health center and say, I need help, whatever they may be. Okay, let's figure out what we need to do. And it's brought forward under the primary care model. And I'll talk about this once or twice more along the way, but there's this thing called the patient-centered medical home. It's actually a patient-centered medical home is a recognition platform from the National Committee on Quality Assurance by NCQA. We could throw acronyms at each other all day too if we wanted to do that. But primary PCMH, patient-centered medical home, is truly that. When you listen to the words, patient-centered, so the patient's at the center instead of the other way around. What we've always done in medicine is that we bring this whole group of people together and the patient's out here somewhere and we try to treat them. Well, what a patient-centered medical home is that the patient's at the center, the family is at the center, and we pull in those professionals that are needed to make that patient's experience that much better. So the patient-centered medical home is a big component of what you get, even though it's not a service unto itself. It's how the practice works with all the individual patients and their families. So that's a piece that when people say, what kind of services do you have? I always throw that in. I said, they're patient-centered medical homes. Look it up sometime. It's amazing what you have to go through to get that recognition. And every single one of the health centers in the state of Connecticut is a patient-centered medical home, unlike the rest of the marketplace.
There's a common misconception that community health centers have unlimited funding from HRSA, the Health Resource and Service Administration.
You say that well.
Can you explain a little bit about the financing of health centers?
Sure. Health centers are partially funded by the federal government. So HRSA, you adequately spelled it out, I'll leave it there, is the regulatory body over the health centers. So that if you walk up the way, towards the president, if you would, HRSA sits under the Bureau of Healthcare, of Primary Healthcare, which sits under the Health and Human Services Division, which is a cabinet position. So it's about 3 steps away from the cabinet. And it's partially funded by the federal government. And that was when I said back before, I said that anyone presents to the health center, regardless of pay, that's what you get with the other piece of that, is that you have to accept everyone. If the federal government's going to hand you some, basically it's a grant, and it's overseen. There's a lot of regulatory issues that go with that. But if you're going to accept this money, then you got to treat everybody that walks in the door. And it's about, in the state of Connecticut, about 15% are not paid for, or they used to have a sliding scale payment. There's all sorts of arrangements that can get made. The key is get people treated. So the bottom line is we're not letting you go back out the door without making sure we got you on the right pathway. So the funding comes from multiple sources. They're not-for-profit organizations. So they look for funding from grant opportunities, from donations, volunteers, and they do have the services that they provide they can bill for. So if they can bill in a Medicaid program, there's quite a few, probably 60 to 65% of the clientele that any health center would have is going to be a Medicaid client, but they're a good partner. But they have contracts with Aetna and Connecticut and all the other insurers in the marketplace. So about 15% of the revenues that the health centers bring in are from what people would look at as, say, commercial payers. So it's not just a clinic that people go to for free care. These are well established. It's when I made the rounds, when I first got hired, and I made the rounds to go see all the health centers in the state, I'm absolutely amazed at the capabilities that are there. The physical structures are beautiful. They have, there's over 100 sites. There's 16 community health centers underneath the umbrella of the association, and there are like 100 sites throughout the state. So it's not just, think about the Staywell. How many places of Staywell have you realize there's more than one building, right? There's the main campus, and it's where we are today. There's others. So each one of the health centers has a number of places to go. So the financing of health centers often is under scrutiny because they do get a sizable, and they only get paid. They only get paid for what they do, and whatever they do in one single day, they get one fee. So they don't get multiple fees wrapped on top of each other. So there's the misconception is just that. It's a misconception. They're grant funded up to a point, but certainly is not a free ride.
Have health centers played a critical role during the COVID-19 pandemic?
Absolutely, a huge role. One, as I mentioned before, the behavioral health component of that. So a couple of things worked against us to start it out, but then in favor. So on day one, the world shuts down. So 18 months ago, everything just comes to a screeching halt. People don't go out of their houses. They don't go to their medical doctors. They stopped going to the health center. And they're like, but these patients, most of them, many of them had disease that needed to be treated, but they were more scared of the virus than they were to not going to see the doctor. Nothing's gonna happen to me today. I was okay yesterday, So all of a sudden volume just plummeted. So health centers look at what can we do with this? Their own employees are asking, should I come to work? Should I come out of my house? But those that do it, there's not enough volume to keep things going. Or that people are going to get laid off. Are they going to? So everybody, all the medical practices around having this problem. So what happened was all of a sudden we said there's got to be a better way. So innovation takes over, and people start talking about doing visits electronically. So the world of telehealth kind of came in and took over. And then specifically telephonic telehealth, in other words, just phone, because there are many clients of a health center that don't have access to broadband. Connecticut, all the stuff we do have for infrastructure, we're not so hot on the broadband side of that. So there are lots of pockets where you certainly can't get video. But if you can get audio, you can talk to someone, then we can. So we actually worked with the legislature of the state of Connecticut and worked with the Department of Social Services, and we got approval, not just us, but everybody got approval to use telehealth as a mechanism to see a patient. So all of a sudden things turned back around, and especially for the behavioral health side of the world, that worked out very, very well. And so that was kind of how it moved into the new. So innovation worked out to really help. So that was the beginning of this, and now we have to get patients tested. So now there's this big push. So we actually there's a coalition formed of providers that were willing to do testing, and all the health centers in the state agreed to help out with all of this. And I think that in the last count, 200,000 to 300,000 people were tested by community health centers. The number, it's just unbelievable. When you look at there's 3.5 million patients in the state of Connecticut, and 300,000 were tested by the health centers. So that's the testing side of this. Then you have to find, okay, if somebody tests positive, you need to let them know, and you got to put them on a treatment plan. And so now we get into all these social service issues that have to be coordinated. Remember I said before, what you really get when you go to a health center is you get a coordinated care model that incorporates medical and behavioral health and dental and all the rest of those things. So that was the testing side. So now we identify things. So now what comes next? Vaccinations come next. Excuse me. So now we've got the same population we were treating it and testing before. Now we need to get them in to get their shots. And so we're still working that one. If this program can help find those patients who are either scared or don't believe it or whatever, get vaccinated. If you look what's going on right now with the new variants that are out there, we're going to be back on square one if we don't do this the right way. And truly, I said this at another meeting I was at the other day, shame on us if we don't do it right. We've had a chance. We've already been through this. That's one of those lines is, but hit me once and it's shame on you. Hit me twice, it's my own fault. Right. So we really just, I really hope that the marketplace works in that direction and people really do come out and get vaccinated. It's just something we can all do to make this work. And if you go to a community health center, you'll get the sense, nobody's dictating that you have to, We're not there yet, but we really want people to get that because it's just a symbol of the marketplace of what we can do as human beings to make this thing work. And it's really difficult. The black and brown community has had a difficult time with this, and for legitimate reasons. And the biggest one being trust. There's a line that I've used at business meetings. I said that business and therefore healthcare moves at the speed of trust, and that's hard. Think how easy it is to lose someone's trust, and how difficult it is to regain it. And so we're trying to make sure that people know that it's a trusted world, and I'm hoping that it continues to move in the direction that it is, because it's getting better. But we'll get there.
Why should we celebrate Community Health Center this week? You didn't give us a lot.
I was going to say, sounds like a great idea. So August 8th to the 14th, I think are the actual dates. And what it is truly, it's a celebration of the comprehensive care model that is brought forward for anyone who needs it. On a regular basis, it's some of the best care, and all the, as I went through my career path and looked at all the disciplines I worked in, this is a group of people at health centers that really cares, that truly puts the patient first. And that's one of the reasons I looked at this and said, it's so important that you have that trusted back to trust, that trusted relationship with your practitioner, that you can, go to a health center. You might not get the exact same person that next day, but they're coordinating the care with you, and it is part and parcel to what they do, and they truly believe and really live it. And I think that's what makes the real difference. So it's diversity aware. It's truly, when we talk about health equity, it's such a big deal, because when you look at what's going on in the world, if you don't have access to health care, that on an equal basis of everyone else is out there, you're stacking the cards the wrong way. So we really do need to take a look at how we deliver that care, and to who we deliver that care, and what kind of accommodations can we make to make it work, so that the best outcome is that patient that works with you. And when you get that kind of an outcome, your quality scores go up, and it looks better, and it gets published, and all the rest of those things. And then that falls back into that thing that FQHC is the Federally Qualified Health Plan, is working under a patient-centered medical home model to get a win. Right.
We hope that you have enjoyed our discussion today, and we have learned so many new things about the community health centers, and encourage you to find a health center near you. Join us on August 24th as we talk about the upcoming National Overdose Awareness Day on August 31st. Until then, stay well.